Hello guys, welcome back to my channel. I am your very own Dr. Sahiba and I am very overwhelmed with the kind of response I am getting for this recall session. And actually during my residency hours, this is the happy time when I make video for all of you. It gives me a kind of very beautiful satisfaction and a kind of happiness that I am doing something for all of you. I hope this is going to help you. If this is going to make at least a 1% of difference in your difficult journey now, then yeah, this is worth it guys. So let's start with today's recall topic, and as all of you know, the topic of the day is the menstrual cycle. So today we are going to recall the menstrual cycle together, and this is not a revision. As I said earlier, this is a recall session, so you have to answer with me very quickly. Then only we are going to wrap up this topic in a minimal time with covering all the PYQs. Okay, so let's start. So let's start with the menstrual cycle. But before starting with it, let me clear each and every word I am going to utter is either a previous year question or a predictable question, guys. So you have to pay your 100% attention for this recall session so that you can make most out of it. So put all your stuff aside and just hear me out so that it will be a faster, quicker and a very wise recall session. Correct. So let's start with the menstrual cycle. So basically the menstrual cycle has two phases. From day 1 to day 14 it is called as the follicular phase or the proliferative phase, and from day 14 to day 28 it is called as the secretory phase or the luteal phase. The first phase is under the effect of estrogen and the second phase is under the effect of progesterone. Okay, clear with this? So what happens is that when a female is in the 5th intrauterine month, so she has the maximum number of the ovarian follicles in her body. What does this ovarian follicle made up of? The ovarian follicle made up of three things, guys. First is the primary oocyte, second is the theca cell, and third is the granulosa cell. So recall with me what this ovarian follicle is made up of. First is the primary oocyte, second is the theca cell, and third is the granulosa cell. And we are going to come across these words many times, so make this clear in your mind right now. So now we are going to see the oogenesis and the hormonal effect together so that you can get a better and a bigger approach to solve the MCQ. So what happens is that when a female is born, she must be having many ovarian follicles in her body. Does that mean she must be having many primary oocyte in her body? Yes, because the primary oocyte is present in the ovarian follicle now, right? So she must be having many primary oocyte in her body, but these primary oocyte do not get converted into the secondary oocyte. Why? Yes, very good. Because the meiosis 1, which converts the primary oocyte into the secondary oocyte, gets arrested at which stage? At a diplotin stage. Because of that, the meiosis 1 do not get completed and the primary oocyte do not get converted into the secondary oocyte. So when this meiosis 1 gets resumed? At puberty. And why? Because the hypothalamo-pituitary axis gets activated. Because of this, the hypothalamus secretes GnRH and the GnRH act on the anterior pituitary secretes FSH, and this FSH is going to act on the granulosa cell of the ovary. What? Granulosa cell of the ovary. Did you heard this before? Yes, right now only. In ovarian follicle, we have the granulosa cell, and on this granulosa cell, the FSH is going to act, and this is going to, the granulosa cell of the ovary is going to secrete three very important hormones for us. Okay, the first one is the estrogen, second one is the inhibin B, and the third one is the anti-Mullerian hormone. And all these hormone have very significant action in our body. So let's see one by one. First one is the inhibin B. Okay, so in our further discussion, we are also going to come across the inhibin A. So let's clarify here only. The granulosa cell secretes inhibin B and the corpus luteum secretes inhibin A. Clear with it? So basically just remember the gallbladder GB, granulosa cell secretes the inhibin B, remaining the corpus luteum will secrete the inhibin A. So as its name says that inhibin B, it is going to inhibit something, right? So what does it is going to inhibit? Definitely the hormone which stimulated its action, it is going to inhibit that hormone now, so that it will be giving a negative feedback. So the inhibin B is going to inhibit, or it is going to give a negative feedback to the FSH. And second important point to remember about the inhibin B is that it is going to get secreted from the granulosa cell now. So it acts as the tumor marker for the granulosa cell tumor of the ovary, and this is also a predictable question. The second hormone which the granulosa cell of the ovary secrete is the anti-Mullerian hormone. So you are going to remember the fact that the concentration of the anti-Mullerian hormone is directly proportional to the amount of or the number of ovarian follicles present in a female body. So why this information is important for us? So let's consider a female comes in your OPD and she complains of a primary infertility. What all things you can do for to check whether she is able to conceive or not? Yes, you are going to see the ovarian reserve now. So how you are going to see the ovarian reserve? What does, first of all, let's see what does an ovarian reserve means. Ovarian reserve means whether she has the sufficient amount of ovarian follicles in her body to get conceived or not. So you are going to check this anti-Mullerian hormone, guys. This anti-Mullerian hormone concentration is directly proportional to the amount of ovarian follicles present in her body. So just by taking a break and checking the hormone in her body, you can directly get an idea about the ovarian reserve present in her body, and you can predict whether she will be able to conceive or not. So now you get it why this anti-Mullerian hormone is very important, because it directly gives you an idea about the ovarian reserve of a female. Okay. Now the third thing which the granulosa cell secretes is the estrogen. Estrogen is the predominant hormone, and what does this estrogen do? It basically has three main effects. First effect is that it is going to give a negative feedback to the FSH. Why? Because FSH is going to stimulate the granulosa cell, and granulosa cell is going to secrete the estrogen, so it will give negative feedback to the FSH. Clear with that? Okay. Second thing is that the estrogen is going to give a positive feedback to the LH. Okay, so what does that mean? Because in presence of estrogen, LH is going to get increased, and LH is going to show its effect. And the third thing is that it is going to proliferate the endometrium. Why this information is important? Because basically, let's understand, in a menopausal female, all the hormones are all the hormones, because her ovarian follicle reserve is null, so she will not produce any hormone, estrogen, progesterone, or anything else. Because of that, she will have a menopausal symptoms, and to treat that, we have to give her supplementary hormones, right? So we can give her estrogen alone now? No. Why? Because the estrogen acts as the uterine endometrial stimulator, proliferator. So it is going to proliferate the uterine endometrium, and because of that, there can be a endometrial hyperplasia, or sometimes it can also cause the endometrial cancer. So we never prescribe a menopausal female only estrogen tablets, or only estrogen containing pills. We prescribe them estrogen plus progesterone pills, so that it will get balanced. It will not cause the hyperplasia, or it will not cause the cancer. In which condition you can prescribe only estrogen tablets, guys? Think. Yes, if the female has undergone a hysterectomy. Hysterectomy means if the uterus of that female has removed because of some any condition. But if the uterus has removed, then we can prescribe the estrogen, right? Because we have only problem with estrogen is that it is going to proliferate the uterine endometrium. But if she has undergone a hysterectomy, then we can prescribe this. Yes. So basically the estrogen has these three effects. Come on, recall with me. The first effect is that it is going to give a negative feedback to the FSH. Second effect is that it is going to give a positive feedback to the LH. And third effect is that it is going to proliferate the uterine endometrium. Very good. Now let's see what does this LH cause. The LH has basically three things. It is going to act on the granulosa cell, it is going to act on the theca cell, and it is also going, when its its amount or its concentration is increased beyond some particular bar, then it is also going to cause the LH surge. Let's see one by one. The LH, first of all, is going to act on the granulosa cell. Now, when it acts on the granulosa cell, it is going to cause the luteinization of the granulosa cell. Do you know what is the long form of LH? Yes, luteinizing hormone. What does this luteinization means? Luteinization means a cavity, guys. So it is when it acts on the granulosa cell, it is going to create a cavity in the granulosa cell, and because of that, it will be called as the luteinized granulosa cell. And this luteinized granulosa cell is going to secrete the progesterone. Okay, so answer it for me. Which hormone the granulosa cell secrete? Yes, estrogen. But which hormone a luteinized granulosa cell secrete? Progesterone. So the examiner is going to trick you by that. Just adding some one or two words in a question, the answer is going to completely change. Okay, so pay your attention during these revision sessions, as well as during solving the PYQs or any questions, guys, because this is the time when you will build your ability. This is the time when you train your brain how to decode the questions. Okay, so the luteinized granulosa cell are going to secrete the progesterone, but this progesterone will be in a very small amount, in a very small quantity, so it is going to give a positive feedback to the FSH and LH. Okay, so so answer this for me. Is this statement true or false? Before ovulation, the progesterone is going to get secreted. Yes, because though it is in a small amount, but it is going to get secreted before ovulation as well. Okay. Yes. Now the second action of the LH. LH is going to act on the theca cell, and it is going to secrete the androgens. Okay. So the androgens in a body, in a female body, are going to get secreted under the effect of LH, guys. Okay. Now the third thing is that when the amount of LH going to get crossed 200 picogram for more than 48 hours, then the LH surge is going to happen, and because of this LH surge, the ovulation is going to happen, and because of this ovulation, the meiosis 1 is going to get resumed, and because of this resumption of the meiosis 1, the primary oocyte is going to convert it into the secondary oocyte, and hence a female ovulates. Got it? So during ovulation, what happens is that the primary oocyte gets converted into the secondary oocyte because of the LH surge. And the first polar body is also produced. But what happens with the ovarian follicle? Yeah, as you know, the ovarian follicle has the primary oocyte, theca cell, and the granulosa cell. The ovulation happened, the primary oocyte got converted into the secondary oocyte. But what happened to the follicle? The follicle gets converted into the corpus luteum. Okay, and this is a very important thing. So right now we had reached to the day 14 of the cycle where the ovulation has occurred. Now let's go into the secretory phase or the luteal phase. Okay, so what happened in the secretory phase is that the primary oocyte has already converted into the secondary oocyte and it got secreted, and the follicle has got converted into the corpus luteum. So the main thing present in the secretory phase is the corpus luteum, and this corpus luteum has basically secretory activity for these three hormones. Come on, recall with me. First thing is the progesterone, second thing is the estrogen, and third thing is the inhibin A. Got it? Come on, say. The corpus luteum is going to secrete which three hormones? First thing is the progesterone, second thing is the estrogen, and third thing is the inhibin A. Inhibin B is secreted by, very good, the granulosa cell of the ovary, and inhibin A is secreted by corpus luteum. Good. So what happens is that this corpus luteum reaches its maximum size at day 22 of the cycle. Does that mean the progesterone is also in the maximum quantity at day 22 of the cycle? Because the progesterone is going to get secreted from the corpus luteum only, na? So if the size of the corpus luteum is maximum, that means the progesterone in the female body will be maximum in that day. So that day is day 22 of the cycle. Okay. So what happens is that if you want to check whether the female is having an ovulatory cycles or the unovulatory cycles, what thing you are going to check? Yes, you are going to check the progesterone level in her body, because progesterone is going to get secreted at higher amount only and only after ovulation. I say that the progesterone is going to get secreted in a higher quantity, guys. Okay, in less quantity, in very minimal quantity, it is also going to get secreted before ovulation by luteinized granulosa cell, but it will be very negligible quantity. In higher quantity, the progesterone is only going to get secreted in a female body after ovulation. So if you want to check whether the female has ovulated or not, then you can directly see the progesterone level in her body. If the progesterone levels are increased, that means she has ovulated. If the progesterone levels are not that optimum, then you say that the cycles in her body are unovulatory cycles. So this is also very important to check the infertility in a female. Correct? Yes. So what happens is that this progesterone is going to give a negative feedback to the LH. Okay, so what happened, the LH has the LH caused the ovulation to happen, and it caused the follicle to get converted into the corpus luteum. The corpus luteum has secreted the progesterone has the negative feedback to the LH. Okay, so the LH is going to decrease, that means the corpus luteum is going to get atrophied, because the hormone which is responsible for the maintenance of the corpus luteum is, yes, the LH. And as the progesterone has given the negative feedback to the LH is going to decrease, and because of that the corpus luteum is going to get atrophied. Because the corpus luteum is going to get atrophied, the progesterone levels in our body are also going to get down, and because of that, what is the main action of the progesterone? Progesterone is going to give support to the uterine endometrium. It prevents the shedding of the endometrium, right? But now because of the corpus luteum has atrophied, because of that the progesterone also has got decreased, and because of that the support of the uterus has gone, and this is going to lead the menstruation, this is going to lead the bleeding, this is going to lead to the shedding of the uterine endometrium, and this is how the menstruation happens. Clear with it? Any doubt in this menstrual cycle? So now we reach the day 28 of the cycle where the female is going to menstruate. Why? Because the progesterone levels are going to decrease in a female body, or many books says that the progesterone level do not decrease, only the receptors for the progesterone decreases. You can choose the answer depending on the options which you have in your question. Okay, so this is the menstrual cycle. Now let's see certain timelines, guys. So first of all, tell me, before ovulation, which two peaks you are going to see? Very good. Before ovulation, you are going to see the FSH peak and then the LH peak. Okay. So what is the time duration between the FSH peak and the LH peak? It is 14 to 24 hours. Okay. Second timeline, between the LH surge and the ovulation. Come on, recall. 32 to 36 hours. The duration between the LH surge and the ovulation is 32 to 36 hours. What is the duration between the LH peak and the ovulation? It is 10 to 12 hours. Very good. You are going to recall these three timelines before sleeping so that it will get fixed in your mind. Now let's quickly recall certain things. Okay, you are going to answer. I will just name, it can be, you can see it as a one liner. I'm going to just pronounce the question and you are going to answer without options. Okay, first, maximum number of ovarian follicles are 5th month of intrauterine life. Very good. FSH receptors are present on granulosa cell, theca cell. Which cells? Only and only granulosa cells of the ovary. But LH receptors are present on both the granulosa cell and the theca cells of the ovary. Very good. Now the estrogen types. Estrogen, there are basically 3 estrogen types: E1, E2 and E3. And these estrogens are predominant in different female lifespans. And you are going to remember it as MRP 123. M stands for menstruation. When a female menstruates, the predominant hormone in her is the E1. Okay, R is for the reproduction. When the female is in her reproductive period, the predominant hormone is the E2 and MRP. And when the female is pregnant, the predominant hormone in her is the E3. And these are the previous year questions, guys. So the trick is MRP 123. Clear? Okay. So the next question, LH surge is initiated by estrogen, but LH surge is maintained by estrogen plus progesterone. Very good. LH and FSH peak occurs due to, come on, answer. LH and FSH peak occurs due to, very good, progesterone. I have said this earlier that a small quantity of progesterone is going to get secreted because of the luteinized granulosa cell of the ovary, and it is going to cause the LH and FSH peak. Okay, yes. Now the meiosis 1 is resumed at 32 to 36 hours before the ovulation, and it is because of LH surge. Very good. Now maximum size of the corpus luteum is at day 22 of the cycle. Which hormone maintains the corpus luteum in a non-pregnant female? LH. Very good. Because of that, when a progesterone is going to give a negative feedback to the LH, it is going to cause the atrophication of the corpus luteum. Lifespan of the corpus luteum in a non-pregnant female, 10 to 12 days. Lifespan of the corpus luteum in a non-pregnant female, 10 to 12 weeks. Okay, clear with it? So these were certain one-liners which will clarify your concept very nicely. So I added that. Now let's start with the PYQ. I had not included options in this today's recall session. I just want you to get a clear idea about what the question means without getting without seeing the options. Okay, so let's answer this question. There is a woman which has the complaint of infertility, so she should be evaluated for, come on. Yes, she should be evaluated for the serum progesterone on day 22, because the size of the corpus luteum is maximum at the day 22 of the cycle, and so that we can check for the progesterone levels. If the progesterone levels are increased, that means she has ovulated, and if the progesterone levels are not increased, she has anovulatory cycles. Very good. Stimulation for production of testosterone is HCG from the placenta. So these are kind of stuff which you are going to remember. These do not have much explanation, but you can expect such questions, 1 or 2 questions in every exam. Okay, so the estrogen effect during puberty. So this is a very repeatedly asked question. Estrogen cause all most of the effects in a female body except one, and you are going to remember that one. The estrogen do not cause the growth of the pubic hairs. Estrogen do not cause the growth of the axial hairs. These are the effects of testosterone, and you will definitely have this as an option in the question. Okay, and rest all the effects are because of the estrogen. It can be like breast development of the reproductive tract, starting of menstruation, regulation of the pubertal growth spurt, vaginal cornification, cervical mucus production, and the bone formation. All these effects are of the estrogen. Only two effects that estrogen do not cause is the pubic hair growth, and second is the axial hair growth, and these two effects are because of testosterone. Very good. Next question. After ovulation, in which phase released egg is arrested? Secondary oocyte is going to get arrested in the meiosis too now. Yes, because what happens during ovulation, in ovulation, the primary oocyte is going to get converted into the secondary oocyte, and after ovulation they had asked, after ovulation in which phase the egg is arrested. After ovulation means definitely the secondary oocyte is going to get arrested, but in which phase? In meiosis 2. Very good. So you have to read the question very like consciously what the question is like expecting from you. So what if the question has asked before ovulation in which phase the egg is arrested? Yes, the before ovulation the primary oocyte is arrested in meiosis 1 diplotin stage, but they had asked after ovulation. So like pay your attention, most of the 100% attention during reading the question. Okay, it will solve your most of the problems so then and there. Uteroplacental blood flow, it is a like one liner, 500 to 750 ml. And then the fertilization occurs at which site? Yes, ampulla. So there are certain things which you have to remember about the fallopian tube. The narrowest and the shortest part of the fallopian tube is interstitium. Interstitium is that part where the fallopian tube gets the fallopian tube gets inserted in the in the uterus. Okay, most common site for the tubectomy is the isthmus. Very good. And the longest and the widest and most common site for the fertilization is the ampulla. Yes. So these were certain PYQs, certain one-liners, and certain concept about the menstrual cycle, guys. Today before sleeping, you are going to like recall by yourself what we had studied in this recall session. We had studied all the hormonal changes. We had studied all the oogenesis process. And I hope this video is going to clear most of your concepts. If you have any doubts, let me know in the comment section. And yeah, before leaving, do share, subscribe, and share most of the important points and all your doubts in the comment section. And yes, thank you so much. That's it for today. I will be posting the next video as soon as I get time, but if there are some delays, please do consider. And yeah, that's it for today. Thank you so much. Bye bye.